Well, good afternoon and welcome everyone. I'm Beth Stewart, Director of the Texas Oral Health Coalition, and on behalf of the coalition and our conference partners, the Texas Health Institute and the Texas Department of State Health Services Oral Health Improvement Program, I'd like to thank you for joining us for the fifth and final presentation of the 2020 Texas Oral Health Virtual Conference. So now I would like to introduce to you today's presenter. Dr. Rhonda Stokley has served as State Public Health Dental Director at the Texas Department of State Health Services since 2016. She is Program Manager of Oral Health Improvement and Unit Manager of Health Screening and Oral Health, which also includes the Vision, Hearing, and Spinal Screening Program. As Dental Director, she plans and directs statewide dental public health programs and activities including statewide oral health surveillance and preventive dental services. She participates as an oral health subject matter expert for other state programs and represents the agency and state with a wide variety of partners in matters related to oral health. She is a member of several oral health-related committees, boards, and organizations. Dr. Stokley previously served as Dental Director of the Austin State Supported Living Center from 2007 through 2014. She also has private practice experience, including owning a dental practice. She graduated from Louisiana State University Health Sciences Center School of Dentistry in 2005. So now I'm pleased to present Dr. Rhonda Stokley.
So thank you, everybody. Thank you for joining us today. And this is the end. This is the final presentation for this year's Texas Oral Health Conference. This did not at all go the way that we thought it would when we began our planning for this conference, but we're pleased with how it's turned out, and I hope you have been as well. So the final presentation today is from me with the very ambitious title of What Does the Next Decade Hold for Oral Health? Our objectives for this today are to kind of fill you in on our activities and what our program has accomplished over the past year, to tell you a little bit about some of the oral health data that's been released by our program over the past year, and then also just kind of talk about areas of focus on oral health at the national level, and tell you about things that I believe are going to impact oral health in Texas in particular in the next decade. So we'll kind of break this up in two different ways. We'll have the looking back portion where we talk about what our program has done in the past year, and we'll kind of put a wrap on Healthy People 2020 and how Texas has done with a lot of those goals. And then we'll look forward at Healthy People 2030. We'll talk about the Surgeon General's report on oral health that is coming out soon, and then also kind of what our program will be working on in the year to come and the years to come as well. First, just a little bit of update on us. I have been working from home since March. I'm in my office right now just to make sure I have a good connection, but otherwise I'm at home and my kids are home with me. So, you know, we've been going through some of the typical things that you've probably seen on social media where people share activities that they've done with their kids during COVID-19 when we can't get out and about like we normally would. So we have tie-dyed t-shirts. We adopted a shelter pet. This is Callie, our newest member of the family. And we've done some sidewalk chalk art, just to name a few things. I have not baked any bread since I've been home, though. That's one of the big COVID-19 things that I haven't done. And of course, since I'm in control of this presentation, you get to see my highlight reel of some of the things I've been doing. You do not get to see the grimace on my face in the middle of a Teams meeting where my kids are off screen pestering me to do something when I just told them I was getting on a call. You don't get to see those images, but trust me, those things have been happening as well. So first we'll go with looking back. So this past year, we're almost to the end of our fiscal year. It ends August 31st. Things were really rolling along great with the regional dental teams. They had screened over 9,700 kiddos, and then COVID-19 struck. And so basically that aspect of our program came to a halt in March. So no more schools, no more Head Starts. Our team stayed busy though. A lot of them got involved with COVID-19 work for the agency in various aspects. We hosted a meeting last week actually for Texas school-based oral health programs, just kind of an opportunity to share ideas, see what kind of protocols people are working on for getting back into work, what kind of equipment they're investing in, and so forth. I think it was a really good meeting, and we received positive feedback on it. Oral Health by the Numbers, which is our surveillance component of our program. We've really worked this past year on increasing subscribers to our listserv, because that's one of the best ways for us to get new data out as we have it. And we currently have over 4,100 subscribers. So we're very excited about that. And thank you to those of you out here who are subscribers. And if you're not, you can go to our homepage and you will see a link to sign up. I encourage you to do so. And I would like to ask especially that you sign up for it within the next week, because soon we're going to be sending out a survey asking people to evaluate our website. That's something else that we've done over the past year plus, is really working on trying to improve the look and feel of the website and making sure it's useful. It's a really short survey. I believe it might be 6 to 7 questions. So it'll be really quick, and it's really important feedback to help us figure out how to serve you, our stakeholders. We've developed a number of data briefs over the past year, some posters, journal manuscripts. We just received word that a article that we've written for the Texas Dental Journal has been approved for publication. We just don't have a publication date yet. And we've also got something in the works going through the internal channels now related to rural oral health in Texas. A big opportunity for us over this past year was I got to present on oral health at the DSHS Grand Rounds. That presentation was back in October 2019. And that was really good because it really got us in front of a lot of non-oral health people, which is a big goal of our program. We want to, not just stay in our little oral health bubble. We really want to promote awareness of oral health to other non-dental people. One of our data briefs looked at data from the school physical activity and nutrition survey, and a couple of little tidbits from that. 38% of second graders consumed 3 or more sweet or savory snacks yesterday, and 31% of fourth graders consumed a sugary sweet drink at least twice yesterday. So it's that kind of data that helps us decide on things like, having a sugar panel with this year's oral health conference to talk about these things. Another one, we looked at adult oral health using data from the Texas Behavioral Risk Factor Surveillance System. And from that, we know that 14% of Texas adults are edentulous. 59% of Texas adults reported that they had a dental visit in the past year. And white non-Hispanics and Black non-Hispanics were both significantly more likely than Hispanics to have had a dental visit in the past year. Smiles for Moms and Babies is another large part of our program, focusing on reducing early childhood caries. Because of COVID-19, some of our educational opportunities for home visitors and parent educators kind of got a little sidetracked at the end of the year, but we've spent this time really working on transitioning to virtual training. Our Baby Steps for Tiny Teeth videos, which I talked about with you last year, now has an accompanying lesson plan. And here's the link to it. And don't worry, all these slides will be available to you from the Texas Oral Health Conference website. But go to the link and check it out. It's great. It's set up to be about a 15-minute training session that anyone is welcome to use. They kind of guide you through the video and good kind of discussion sort of questions to ask your audience. We have also been working on our planning our outreach to medical and dental providers about treating pregnant women and the safety and importance of dental care for pregnant women. We are in the process of assembling a hard copy of our toolkit, but the digital version is currently available, and you can also check that out on our website. All of those tools are available for you to use either all together, or if you want to pull something out and use it, you're welcome to. Some of the products can actually be ordered from us. You'll just have to look on the website and see what's available for order. Other things briefly that we've worked on in the past year is we've gotten more involved with HPV vaccination, and we're currently collaborating with the Texas HPV Coalition on a project about getting dentists and dental hygienists to make strong recommendations about HPV vaccination. Of course, we're here on the planning committee for the Texas Oral Health Conference. We've sponsored a couple of interns over the past year. We provide oral health education for the preventive medicine residents who are doing their residency here at DSHS. And we serve in a supportive role for the HRSA workforce grant that the 3 dental schools are currently collaborating on. So Healthy People 2020 is now coming to an end. And for those of you who aren't familiar with Healthy People 2020, it's a 10-year set of national objectives to improve oral health of Americans. And it's got a full range of health topics. Anything you could imagine is probably an objective of some sort in Healthy People 2020. There are 17 oral health objectives, and it's broken down into 33 items. So it helps the country figure out, what are we trying to accomplish and have we accomplished it? Well, we also like to look at that for Texas specifically and see how we're doing. Some of the objectives that we have met are related to untreated decay for children aged 3 to 5 and 6 to 9. Also, children, adolescents, and adults who have used the oral health care system in the past year. Now, you'll see there's an asterisk there, and the reason being is because that is self-reported data. So we always have to take that with a grain of salt, because some people are going to put the answer they know they're supposed to put, even if that's not necessarily the truth. So we always kind of have to take that into consideration with that data. We've also met the objective for children age 6 to 9 with a sealant on at least 1 permanent first molar. We've met objectives regarding a system of recording cleft lip and palate and a referral system for that. Not here within our program at DSHS, but DSHS does handle that. And having an oral and craniofacial health surveillance system. Some of the objectives that we have not met are reducing caries experience for ages 3 to 5 and 6 to 9. We did not meet the objective on the proportion of the population with optimally fluoridated water and the proportion of oral and pharyngeal cancers detected at the earliest stage. Now, if you were thinking the math, thinking, well, there's 33 items and that was not 33 things, there are a couple of others that we're working out. We've got to get our data broken out to the matching age range for to match up with the Healthy People 2020 objective. And we're still in the process of a couple of those. But a lot of them we don't have Texas data for. We don't have clinical evaluation data for adolescents and adults. Now, at the national level, they can get that from the big NHANES survey, but we can't break that out to Texas specifically. We've contacted them and asked. So some things we're just not going to have Texas data for. But we're assembling this into a report, and so we'll probably have that out sometime in the next few months. And if you sign up for our listserv, you'll know when that's released. So now looking forward, Healthy People 2030 is on the horizon. They've trimmed it down significantly, not just with oral health, but with a lot of other objectives as well, trying to streamline to some of the most essential items, and then items that they can have sound data for. So 11 oral health objectives. There is a virtual launch for it on August 18th. And I just saw an email about it yesterday. That is on, but I had already gotten this PowerPoint processed. So just Google Healthy People 2030 and you'll see the information about the release. Leading health indicators, I don't believe are going to be announced until October. If you really want to dig in more to see about Healthy People 2020 and how it compares to Healthy People 2030, some of the changes, I recommend going to this link here. There was a nice presentation about it at the AIDPH colloquium that was held back in January. So this is a nice set of slides if you want to dive into that further. So here are our objectives for Healthy People 2030. I'll go through this briefly because you'll be able to access the slides later. It focuses on caries experience, meaning whether or not someone has had a cavity, whether it's filled or untreated, the fact that they've had it. Also untreated decay for various age groups, whether people have lost all of their natural teeth, whether or not they suffer from moderate or severe periodontitis. Again, focusing on oral and pharyngeal cancers detected at the earliest stage, people who have used the oral health care system, low-income youth who have had a preventive dental visit, people who have sealants, young people aged 3 to 19, fluoridated water systems, and states having an oral and craniofacial health surveillance system. A big thing coming up for us in this next year that's going to have an impact on oral health for the next decade is the 2020 Surgeon General's report on oral health. The last one, which was the first one, was back in 2000. So it's going to be great to see what has changed and what in this report they feel like has been accomplished over this past 20 years. It's broken out into several sections, and I'll add that Dr. Paul Casamassimo, who is one of our speakers for the sugar panel, is one of the section leads, but he's not allowed to talk about it yet, so we couldn't ask him any questions. But it's going to focus on overall health and well-being in terms of oral health broken out by various age groups, the workforce, substance use disorders, emerging technologies. And it's going to talk about the importance of oral health as a part of overall health. It's going to talk about contemporary issues, what's cropped up new as a concern over the past 20 years. And it's going to outline a vision for future research and policy directions. Now, this is really important for oral health in the next decade because this carries a lot of weight with it. It's going to drive a lot of things. This is something that we can hold in our hand to wave around as we're applying for grants. When people are trying to have legislation passed, this can be an important document to point to. And also, this is going to drive a lot of funding opportunities from the federal government, depending on what is in this report. Just briefly, some of the other things that I think are going to shape oral health over the next decade: systemic racism and health, and in our case, oral health. I believe we're going to see a lot more attention paid to that. Now, in the public health world, we've already seen this a lot. We're very aware of this, but I think COVID-19 has brought it more into the mainstream consciousness. And I think that's an important thing, and we'll continue to see more about how systemic racism impacts oral health. Workforce diversity in oral health, I think we'll continue to see that addressed. If you attended the oral health conference last year, we had a panel of the dental schools, and all of the panelists talked about how they are really working to recruit a more diverse student body. So we'll continue to see that, and I think we'll see these numbers change over time. The social determinants of health. I mean, again, in public health, we're aware of how these things, you can't just look at health or oral health by itself. There's all these things in the background that point to what someone's health outcomes are going to be. And I believe we're going to see this get more and more into the mainstream consciousness. And I think that's important because those are the people that vote. I mean, when there's things that come up either at the local level or at the federal level to make changes to address these policies, the general public needs to understand how important some of these things are, that transportation is so much more important than what it might seem on the surface. There's a huge ripple effect of all, for instance, with transportation, but all of these different things. And so I think we'll continue to see more awareness of that. HPV vaccination is something we're going to see a lot more in dentistry. HPV-associated oropharyngeal cancer has passed cervical cancer as the most common type of HPV-associated cancer. So we've got to change that mindset that the HPV vaccination is mostly just for girls to prevent cervical cancer. 1 in 9 men have oral HPV, and HPV causes 70% of oropharyngeal cancers. This is the cover of this month's Journal of the American Dental Association. So you can see that they're paying a lot of attention to HPV vaccination. And I'll say that the Texas Dental Association is as well. We've really got to get the word out about strong recommendations. Some children may not be seeing their pediatrician for well checks, but they're coming to us twice a year to get their teeth cleaned. So it's really important, and we want to prevent oropharyngeal cancer. Millennial health is something that's going to really impact health and oral health in the next decade. This is an article, I was made aware of it by an article by Dr. Michael Glick in the Journal of the American Dental Association back in January. That link is here on the bottom. But this is a report written by Moody's Analytics with data used from the Blue Cross Blue Shield Health Index. talking about millennials. Millennials are born between 1981 and 1996. So right now in 2020, they are between the ages of 24 and 39. It's the largest segment of Americans, the largest segment of the labor market, and it looks like they are less healthy than previous generations. And the Moody's report focuses on the consequences for the US economy. People are going to have less savings. They're going to have to spend more out-of-pocket money for health costs. It's going to put a strain on healthcare infrastructure and also less work productivity because people are ill. And it's wide ranging. Death rates among millennials might increase by as much as 40% or more compared with an age-adjusted cohort of Generation Xers. And those are the people born between 1965 and 1980. There's increased deaths from unintentional causes like drug overdoses, increased deaths from suicides, increased behavioral health problems like major depression and hyperactivity, but also more chronic diseases. I mean, the report says, there's not just one aspect of poor oral health. I mean, it seems to be kind of across the spectrum of health that millennials seem to be in poorer shape. And it's expected that health expenditures may increase by up to 33% in their lifetimes. Now, Dr. Glick's call to action on this for dentists, and I stress this too, is that we really need to be watching for these risk factors for chronic disease. And we do this already. We screen for blood pressure, we refer, we ask about smoking habits and discuss cessation. We've really got to help do our part as healthcare providers and help route these people to appropriate care. We're going to see in our chairs a much sicker population at a much earlier age if we can't get this turned around. Additional impacts over the next decade, it'll be interesting to see how they change things. Accountable care, fewer fee-for-service providers. We'll see more group and corporate practices. Health literacy, I think we'll see more awareness and more efforts towards that. I certainly hope so. Value-based payment models, teledentistry. We'll continue to see changes in scope of practice and mid-level providers. Certainly across the country, in Texas, there will be continued pressures for those changes. Now, whether or not we see any actual changes to that in the next decade here, that I really don't know. I would tend to lean towards probably not, but we'll continue to see those pressures. A big change that we've got to see is a way to incentivize prevention, risk-based care, and disease management. Because the way our healthcare system is set up, you treat what you can charge. And we've got to find a way to financially incentivize these things to treat oral health in a different way, not just fix the cavity that somebody comes in with. For our program into the 2020s, I anticipate we'll continue with our population-based preventive services. We'll continue to focus on prenatal, infant, and early childhood oral health, and that also includes educating providers on that. We will continue our oral health surveillance and data dissemination. HPV vaccination is something we'll continue to work on. And along those same lines, oral and pharyngeal cancer screenings, because we really want to increase that amount of people who are detected in the earliest stage. We're going to put more effort into health literacy. We're going to work on oral health workforce diversity and also make strides towards medical dental integration. And of course, I'll at least briefly address the big elephant in the room of everything that we do nowadays. There's a webinar coming up that you might find interesting if you're involved with school-based oral health. It's from the National Network of Oral Health Access, and the link to it is here. It's on the 10th, so right around the corner. And these are available. I'm sure you're probably aware of these already, all the different COVID-19 dental resources. So in conclusion, I would say that I've been really pleased with what our program has done over the past year, even though COVID-19 has kind of thrown us for a loop and it's going to impact the way we do things this coming year. I'm still really pleased. We've got a good foundation set. We've got a lot of support within our agency, which is really, really important. That will go a long way towards what we're able to accomplish. And in general, in oral health for the next decade, I think we're going to continue to see awareness of more of the big picture things, the social determinants of health and how that all fits in. But in turn, I think we're also going to be frustrated by that because those are big changes. I can't go change these social determinants of health to improve oral health in Texas. It's large. It takes a lot of there's a lot of different moving parts to addressing these social determinants of health. And so while I think we will see changes in those directions, I think it's going to be slower than we would want. But as long as we're moving in the right direction, I think that's the important thing. And I would say to all of you, be involved, do your part. Let's look at counseling, dietary counseling for people, because sugar consumption is a problem, not just for oral health, but overall health. Talk to your patients about HPV vaccination because we want to prevent cancer. There's lots of things, both big and small, we can do. If there's legislation that you're interested in or against, contact your legislators. I mean, that's a really important thing. Be involved and do your part because every little brick will help build a wall. So thank you. I appreciate your time and attention today. I'll turn it back over to Beth, and I'll also answer a couple of questions. But please also stay tuned because after the housekeeping segment, we will have the Texas Oral Health Coalition's annual meeting. So thank you again.
Well, thank you, Dr. Stokley, for the report and update on the Department of State Health Services activities. Very informative. We do have a couple of questions. The first one that came in was, can we order that poster from the website? And that came in at the very beginning. I believe they're talking about the school-based program.
This one, get an easy A.
Yeah.
I do believe that is available to order. I am pretty certain. And we had sent out an announcement in it about it in the Friday Beat, which of course everybody doesn't get, but it's something that circulates to school nurses in particular. But yes, that is available. If you don't see on our website how to connect to it, you'll see just a general contact us, dental at blah, blah. So send us an email and we'll make sure we get you connected with some of those posters.
Okay, great. Now, this question came in before you actually started talking about COVID-19. How do you see COVID impact Healthy People 2030? Did you have any additional comments you wanted to make about that?
How it will impact Healthy People 2030. Over the whole span of it, by the time we're looking at how did we do with Healthy People 2030, I don't think we will have an impact from COVID-19. We are going to get to some stage where either treatment or vaccination, where we're not going to be living the way we are at this time. But in this next year or two, it's going to make a difference in a number of different ways. I mean, there's a big concern right now getting children caught up on vaccinations because people are staying home, they're sheltering in place, they're afraid to go to medical offices where, they worry, is there someone sick in there with COVID-19? And so that's just one aspect, or people falling behind on dental care for the same reason. So I think we'll see that in a number of different ways across all aspects of health. People ignoring or putting off, delaying health care because of fear of going out for COVID-19. So yes, it's going to make a difference. It will in the beginning, and then hopefully we will level out from that and continue towards working and meeting these objectives.
Okay, thank you, Dr. Stokley. The last question that came in was asking when the next conference was. So please save the date for July 7th through 9th, 2021. We're going to try for an in-person conference again at the Sheraton in Georgetown. So that's again July 7th through 9th in 2021.